County government of Marsabit. Uh, Initially, we have been having a lot of challenges in terms of drug supply to our health facilities, but we are happy. We have pleasure to inform you that yesterday we received a quite huge amount of medical supplies for the entire county, that is dispensaries and health centers. So we launched at the office of the governor with His Excellency Deputy Governor. The truck left yesterday for our rural health facilities, dispensaries and health centers. We made a requisition of drugs worth 50 million at KEMSA Kenya Medical Supplies. Last week, Thursday, Friday, the drugs were delivered at our Marsabit County Referral Hospital and the four other sub-county referral hospitals, that is Yasambaza sub-county, Kalacha, Sololo, and Moyale sub-county. That was delivered on Thursday, Friday last week. But part of that consignment is what we yesterday released to the rural health facilities. The 6 trucks that left is part of that requisition which we made. We made requisition of drugs and medical supplies, non-farms and all that, which are assorted drugs and pharmaceuticals, were the 50 million, but what we received is 42 million because they didn't have the balances of what I've just mentioned, 50 in the stock, which we are going to make requisition later on the same back requisition so that we'll be able to receive them. Fortunately, all those trucks are taking directly those commodities to the health facilities. I'm sure you are in the know, the farthest facility from this headquarter, like Eleret, is over 500 kilometers, and those trucks will deliver right at those respective facilities, and our facility in charges will receive them accordingly. So I want to inform the public, the good people of Marsabit, that as County Department of Health, we are happy, we are honored to inform them that going forward, drugs are available. We have adequate drugs and other medical supplies at all our health facilities. We have been grappling with a lot of challenges initially because we made requisition, payment were not forthcoming because of delay in disbursement and the exchequer release from the National Treasury. So there has been a lot of delay in terms of receiving these commodities. But we are lucky, however, let now drugs and other medical supplies are available at all our health facilities. In the next few months, we don't anticipate any shortages of drugs and medical supplies in our health facilities. Thank you so much.
And now you have said that you have received drugs. How many in terms of maybe 1,000 drugs, maybe 10,000 drugs, or just a total number of drugs, apart from just giving us the amount used, like 50 million? How many drugs have you been distributing all over? Maybe Lesamis 100, Sololo 100, maybe just like that summarize.
No, maybe well, I may not be able to exactly give like that because every facility has their own requisition. For example, facility X, maybe in the bill, will have their requisition based on their need. Marsabit County Referral Hospital, like Samis or any other hospital, based on how consumption is in that facility, they make their own requisition. So that is why the requisition are coming based on specific facilities. So from where we are seated, I'll not be able to say we have this number teens panado, we have this number of antibiotic. I cannot say that from where we are seated. But the details are available at our county pharmacy here. Each facility, specific facilities, if specific dispensaries have their own requisition, the request that they have made based on their demand. So those are available, but from where we are seated, I cannot say this number of things are available at these specific facilities.
So there's no
but
any
the
universal
50,
data.
sorry?
Universal data is in when you say what medicine which have been acquired and they are in Marsabit County. Universal data in terms of maybe they have been brought to Marsabit County.
We have the drugs and the non-farms. What we call non-farms are issues like gloves, masks, syringes, needles. These are called non-farms. The rest are the drugs. So that's why I'm saying they are assorted various items. But if you want to see specifically, for example, a dispensary in Telesgai in Eleret received what, you will be able to see that list at the facility and also our county pharmacy here.
Okay.
Yeah.
And there's been this norm whereby you go to the chemist and you find that there is a drug written not for sale for the government. They are being sold in the chemist. So what are the criteria you're using to ensure that these drugs, if being distributed to the hospital, they remain to the hospital, not to the chemist? Because there's been a norm whereby you find a drug there, you buy it there, this is written government, not for sale. So what are the measures as the CC?
Maybe in some classical cases such issues can happen, but why we are even encouraging to mitigate that challenges, we are even encouraging from KEMSA the drugs and those commodities directly to go to the facility. That's why we are encouraging that. So that if it is received at that specific health center, dispensary, or at our hospital here, then charge somebody will sign against the items that you have received. And like for our county referral hospital and sub-county referral hospital, they are fed into the system, into the computer, where we say specific items are as received, they are entered. And when they are dispensing off to the patient, it will keep on removing from the system. And our county health management team sometimes can visit specific facility to counter check whether those items, medical supplies or drugs that are